The following recording is an extract from the BBS UK Medical Information Booklet and includes information about obesity in Bardet-Biedl syndrome, BBS. Information about other features of BBS, genetics, diagnosis and family planning, the specialist BBS clinics and the charity, BBS UK can be found on the BBS UK YouTube channel and on the BBS UK website. The medical information booklet can also be downloaded from the BBS UK website www.bbsuk.org.uk. The information contained within the medical information booklet has been provided and checked by the BBS Specialist Clinics team and where possible is supported by research and published articles. A full list of references can be obtained from tonia.heimers@bbsuk.org.uk. Bardet-Biedl syndrome clinical features and presentation. Obesity. Obesity is reported to occur in 72% to 92% of affected individuals. Weight issues usually begin in childhood and, with age, increase in severity. Many children exhibit rapid weight gain within the first year of life, but others may not present with weight concerns until puberty. It must be remembered that BBS symptoms cover a spectrum, so everyone needs an individual assessment of their weight or dietary concerns. The majority of adults who have BBS have a BMI greater than 30, which is often accompanied by other health issues. For example, hypertension, high blood pressure, dyslipidemia, an abnormal amount of lipids such as cholesterol and/or fat in the blood, and type 2 diabetes mellitus. Fat tends to deposit within the abdomen, which is a cause for concern as the distribution can be linked to high blood pressure and elevated triglycerides, a type of fat found in the blood. The cause of the obesity associated with BBS is unknown, but is the subject of current research. There is certainly a dysfunction of appetite regulation which can lead to hyperphagia, excessive appetite, and energy intake exceeding requirement, which makes dietary management challenging. Treatment. Understandably, diet and weight concerns are a major source of stress for patients and their families. The knowledge that untreated obesity can lead to multiple health problems, for example, metabolic syndrome, diabetes mellitus, and cardiovascular disease, adds to this stress. Unfortunately, there is no single treatment approach for obesity in BBS, just as for obesity in general, but those with BBS can successfully lose weight, or in younger children, control their rate of weight gain, whilst ensuring height growth is maximised. A healthy, well-balanced diet and active lifestyle approach is advocated, and for some, considering the glycemic index of foods may also be useful. Portion control strategies are important, because of excessive appetite that can be associated with BBS. Very low-calorie diets, as used to manage Prader-Willi syndrome, are not warranted, as this is an over-restriction of energy intake. Dietary advice should be tailored for an individual to address their weight or dietary concerns. It is important to intervene and educate with dietary strategies to control weight gain in childhood, as these are more likely to have a lasting effect into adulthood. A multidisciplinary approach is needed and should include dietary advice, behavioural management, and exercise. Early referral to a registered dietitian with either an interest in BBS or experience in obesity management is important, and attendance at the multidisciplinary team BBS clinics is strongly advised. Pharmacological and surgical management approaches for obesity are available, but associated risks and benefits need to be carefully considered. These treatment options can be advocated only if strict criteria are met and when traditional methods have failed. Bariatric, weight loss, surgery is considered only for life-threatening obesity, and its use in young patients with genetic syndromes of obesity is rare, with only a very limited number of cases reported in the literature. However, bariatric surgery may offer an alternative treatment option when traditional non-invasive methods of weight control fail. It is important to note that specialist dietary advice and support is needed post-surgery, and compliance with these dietary restrictions is imperative. It is not an easy option and is not suitable for all individuals. BBS patient. I'm really into sports, and when I found out I had BBS, I didn't think playing sports would be possible. However, a whole new world opened up for me after I went along to a vision-impaired cricket event. To my delight, I won the Best New Player award at my first match. BBS patient. I keep myself fit by going to my local gym, which I attend 3 times a week. I'm good at rowing. I can do 2,000 metres in 10 minutes. I also enjoy the cycling machine and running on the treadmill. I use the weights as well to keep fit. For further support or information, BBS Specialist Clinics, Dietetics. Contact your dietitian for advice and ongoing support. For more information about BBS Specialist Clinics, go to www.bbsuk.org.uk. This information is meant as a guide only. If you feel concerned about anything you have heard, please seek medical advice from your GP, consultant, or a member of the BBS Clinics team. We welcome your comments and feedback. Please send to info@bbsuk.org.uk or tonia.heimers@bbsuk.org.uk.